Welcome to the start of the 4 pillars of health. And so this month I'm going to be talking about each one of the pillars to explain a little bit in generic terms what this means for us. And so today is the very first one, which is your physical health. So your physical health is the engine of your whole life. So there's a quote, and I can't pronounce the man's name. It's V.L. Alenier, something like that. Anyway, it says, if your body's not right, the rest of your day will go all wrong. So if this physical body has issues, you are going to have some problems. Now, those problems could just be slight limitations to being massive limitations, like some of the things that my husband has gone through, to being complete limitations, whereas you have a heart attack and that's the end of your life. Okay, so your physical body plays a big part, of course, in your life. And so your body is the vehicle that carries you through everything you do, your work, your relationships, your goals, whatever you're trying to do, your family, your children. When you feel good physically, then everything else becomes easier. So I talk to a lot of clients who talk about how it's difficult for them to be with their grandkids, get down on the floor, things like that, because of the limitations that their physical body has. And so the healthier you are physically, the more you're going to be able to do and the easier that's going to be to do. So if you think of your energy levels, it's like a gas tank. Your gas, if you don't have enough gas, you don't have enough go. So you're going to be running on empty. And it's more, your physical body, I've talked about this before, it's more than just exercise, what you need to do. Your physical health includes what you put in your mouth, biggest thing, your nutrition, what you put in here makes a big difference, the biggest. Your sleep, your hydration, healthy movement, not necessarily going to the gym or running a marathon or anything like that. So taking care of those things creates a resilience, not just weight loss, if that's what you need. Some people, they don't need weight loss, but they still have no energy. So proper nutrition is what gets you that. So your body affects your mind. So when your body feels sluggish, inflamed, it affects your thoughts, it affects your mood, your movement, and your nutrition impacts your stress level, your anxiety, mental clarity. The brain is part of the body. So treating it like a separate thing doesn't work. Your every part of this, because we tend to separate, our brain from the rest of our body, our mind, okay? What we put in our mouths affects our mind, our brain. And prevention, big, powerful thing, okay? It's much easier to maintain your health than to recover it later on. So chronic issues like diabetes, I've talked before about diabetes. My husband had diabetes and it caused retinopathy in his eyes, woke up blind in one eye, and now the other eye, he needs more treatment because it starts there. That cannot be reversed either. By the time you wake up blind and wide, damage has already been done 10 to 15 years prior. So, it affects a lot of things. Your movement and nutrition impacts your stress, like I said, anxiety, mental clarity, and the brain is a physical part of your body. Prevention, big time, like I said, it's much easier to prevent those chronic things. Diabetes, heart disease, another one, we've talked about that. I have a friend whose husband didn't want to prioritize his own health because he was providing for his family and had a heart attack, and unfortunately it was fatal. It can even cause joint pain, and all of that starts with neglect. And we put a lot of other priorities. Women tend to put a lot of priority on what we do for other people, but not what we do for ourselves. And I keep going back to that. When you fly, they say, put your mask on first. It's counterintuitive because we always think, we want to take care of our kids first. We want to take care of the elderly or, somebody we're responsible for first. But you can't do that if you don't take care of you first. If you don't put your mask on, you may not be around to put their mask on. And so the other thing is that small choices make a big, it's small steps, makes a big impact. And then you have fewer regrets later on when you start making those changes. The other thing is to start where you are. So a lot of times people think, oh, I have all of these habits, I need to overhaul everything. So if I don't do it perfectly and I don't do all of it, it means nothing. And that's absolutely incorrect. That's the enemy coming in your ear telling you that if you can't do it all perfect, don't bother, don't even try. And that's not true, because you can add little things. Like I did a squat challenge on my Facebook, and there were a lot of people who started with just a few squats an hour, and then they decided they're going to do some more. And some of them are up to like 25 squats a couple of times a day. I mean, this is little things make an impact. Walking, adding more water, getting a little bit better sleep, it all counts. It all adds up. Don't compare your journey to others, because everybody's different. Physical health for me may be very different from physical health for somebody else. Man, woman, old, young, having a chronic issue, just being a different being makes a big deal. And then your health is also a form of worship. So the Bible talks about being, stewarding the temple well. Your body is a temple. And so it's, something that we need to take care of our body, that we've been given to steward. And respecting our body reflects self-love and purpose, and also guidance, because God wants us to be healthy so that we can do more things of whatever it is He's got for us. So that all being said, my challenge for you, because I'm going to end each one of these with a challenge, my challenge for you is to think about, reflect on, what is your biggest physical challenge in your physical health? So I'd love for you to share below, or you can message me and share what is your biggest physical challenge. I'd love to be able to just give you some tips, or encourage you, or whatever. So that's it for this week, physical. Next week we'll go into one of the other pillars of health, and be healthy.